Thank you, Abhishek. Very, very happy to be part of the event, even if I'm not there physically. And all the very best for the event also. Um, the challenges that the parents and the children in India face in public hospitals, maybe before that, even getting to the public hospital, accessibility to treatment is a big problem in countries like India because our treatment centers are based on big cities. We have very few treating centers in India for childhood cancer because pediatric oncology as a department or as a different part of medical oncology has developed only in the last 10 to 15 years in India.
Okay.
So the treatment centers are all in big cities. So the accessibility to treatment is a major problem. Uh, is the solution to have treatment centers in every small towns in India? May not be,
Yeah.
because the numbers are not enough to sustain such treatment centers.
Correct.
Uh, but this actually makes it very difficult for the parents to bring the children on time
Yes.
to the big cities and the big hospitals because the correct diagnosis may not be done in the small centers.
Correct.
And also uprooting the entire family
Yes.
from a small village to the big city for the treatment purpose alone may not work for everyone. Let us be very realistic.
Yeah,
The,
livelihood of the families, the
yes,
other siblings of those
yes,
children.
yes,
Mhm.
yes. It's dividing the family. Usually, the other children are given to the grandparents to look after at that time, or aunts and uncles. At least in India, that is possible because our strong family system and even the joint family system still prevailing in many places. Um, but it's still difficult because both the parents need to leave their jobs.
Right.
It's not only leaving their jobs; they have to sustain themselves in the new city.
Right. Right.
And as you know very well, the treatment doesn't get over in a day or two. It
Yes.
goes on and on.
Yes.
Um, it goes on for 3 years and more sometimes for
Yes.
certain types of cancers. So
Yes.
it is not easy. So government hospitals basically the treatment is free.
Hmm.
There's no doubt. But the problem comes only when specialized tests are not available in the hospital and it has to be given outside.
Okay.
So if it is a small center, a small government hospital, and if there are no NGOs working there, then the entire burden falls on the parent.
Okay.
But the places where Aroh and other NGOs work, all these things are taken care of by the NGO. The parent doesn't have to know anything. If the PET scan is needed in an outside lab, the social worker of Aroh or any other organization will arrange that. The money,
The money
no,
also.
the everything. So there is no burden on the parent.
Mm-hmm.
Whenever there is something outside the hospital is needed, it is arranged. There
Arranged.
are home away from homes that other NGOs run
Yes.
nearby the hospital where the parents and the child can stay for free of cost. So if
Yes.
there is an RO social worker in the hospital, then he or she will be the person who will arrange it.
Yes.
Tell the parent that, okay, this facility is available, don't worry.
Yes.
You don't have to worry about your stay or food or anything. Even
Right.
transportation, because there'll be vehicles from the home away from home to bring you and then take you back.
Very good.
Because information is important, right?
Yes. And then
And
this is where I think you guys also needs to track everything around what's happening for that child. What kind of treatment,
yes,
when he needs to come for 2 days, when he needs to come for 1 day, or when he can just stay in their village, in their hometown. And
yeah,
then,
yeah.
mhm.
So first of all, that this human resource is important.
Yes,
No NGO can work without human resources.
correct.
Anything that we conceptualize should be executed through humans.
Humans, yes.
Yeah. So this is one area where we all need money, that we need to pay them salary so that they are there looking after our children there.
Yeah.
And in all the major centers, the numbers are very high. So if you take the regional cancer center for Telangana and Andhra Pradesh, that is called MNJ Hospital.
Yes.
It's a 108 bedded pediatric oncology ward, one of the biggest in India.
Yes.
And we have two social workers there. The Institute of Child Health, the government hospital in Chennai, has a 65 bedded ward.
Great.
Again, we have two social workers there. How
Mm.
are these social workers going to keep track of all these children?
Yes, it's
It's 108 and 65 inpatients.
and
You
those
have
are
seen that
in the hospital.
admitted. Yes, you have
Accredited,
seen
and
the
then you have others who are
you
still.
have OP. You have OP where again it is 40 to 60 kids coming every day. You have seen the OP of Tata Memorial, where we
Correct,
have a social worker there. The
correct.
OP itself is around 100 to 200 children per day.
Per day. Hmm.
And social workers, we actually can't even give them laptops for everyone because we don't have the money.
Understand.
So it is all manually written down.
Yes,
So it actually is the social worker's duty to call up and remind the parents to come on a particular day for chemo, because the parents don't understand why the chemo should be done on a particular day.
yes. And this has
Why
clinical
is the
relevance. This has clinical relevance. Yes. Mhm.
yes, because if it's a solid tumor, it is on the 28th day. Why is it on the 28th day? Why is it important? I don't have money to come today. I'll come 2 days later. What is going to change?
Yes.
So
Yeah.
it actually is the social worker's duty to call up and tell them that no, you come. You if you don't have money, borrow and come. We'll give you the money, but make sure that you do it on 28th day because there's a reason for that.
Yes. Yes.
So, but social workers are human beings. I mean, the manual system actually can have mistakes.
Yes.
So that is where the app you developed. No, I was interested the very first time we talked. I
Yes.
think it was in Barcelona, right?
Yes. Yes. Barcelona.
Yeah, yeah. So because this is the first thing that came to my mind, we can actually bring down or eradicate the human error
Yes.
that can happen if the social worker can get a reminder saying that so and so child is supposed to come day after tomorrow,
Yes.
or that this test needs to be done tomorrow.
Or in a
That
different center. So
in a
this new
different center.
arrangement. Yes.
Yes, it could be a CBC test that they need to do every month,
Yes.
but they're back in their village.
Yes. Yes.
The social worker is supposed to remind them.
No, I
So
think
these things,
these things also are important because travel is a burden, right? Because they need to leave
yes,
everything, right, and then
yes,
come with the child. Of course, there is
yeah,
an impact also on the child depending on the age, school, friends, other stuff, but
yeah,
also livelihood is broken, right? If they have to travel
yes,
for 300 kilometers.
yes. And that reminds me, actually, the CBC, you know that every month the CBC should be tested and
Yes,
given the result to the hospital. So we social workers tell the parents the same thing. You don't have to come for this because it's too much of a burden for you.
right.
So where they go for the test itself is usually the social worker who Googles it and finds for them, because
Right.
it has to be a decent lab.
Yes.
So the because results
It
needs to
has
be
to be
correct.
accurate. The
So
results
even
have to be accurate.
accurate. So the social worker finds out that and tells them actually go there and get it done and WhatsApp it to me. I'll
Yes.
show the doctor.
Yes.
So instead of that, if there is a technology which both the social worker and the parent can access,
Correct. Correct.
then this doesn't disappear from the social worker's WhatsApp, or he or
Yes.
she doesn't forget about it, because it's a system,
It's a
and
system.
and the social worker can show it to the doctor. And if doctor is also in the technology, then it is a three-way thing.
Yes. Yes.
No one forgets all these things. So that will be hugely helpful. So it is actually called Ayushman Bharat.
Ayushman Bharat.
Ayushman Bharat is our universal health care for the uh, less fortunate in India.
Yes.
So, like in the Europe, it's not a universal health care for everyone in India, but people below a certain economic level.
Yes.
But for them, it is a universal health care. That's how it works. The problem sometimes is that every state has its own authority, right? So a
Right.
lot of states won't accept Ayushman Bharat. They won't take it. So they have their own state insurance
Right.
in different names. So like in Kerala, it's Karunya.
Mm-hmm.
So in Karnataka, I forgot the name, but it's a different one. Tamil Nadu has a CM's insurance scheme, the Chief Minister's insurance scheme.
Okay.
So it will be different. If there is Ayushman Bharat, then it covers everything.
I see.
If it is state-wise, sometimes it covers fully, sometimes there is up to certain amount.
Right.
Sometimes it's both integrated in certain states. The state insurance is integrated into the Ayushman Bharat.
Ayushman Bharat.
So
Okay.
basically, without even if none of these things are there, in a government medical college or in a government regional cancer center, basically if you come with a certain economic level, then because there are cards and all for that,
Correct.
so with that the treatment is absolutely free.
Mm-hmm.
That is why if you go to Tata, it's a very developed center.
It's one of
It's a
the
yeah,
hospitals. Yeah.
it's one of the finest or the finest.
Yes.
It's a research hospital, it's a teaching hospital. So there, if you go, everything is free because everything is available. They even have proton radiotherapy,
Radiotherapy,
which
correct. Yes.
which
Mm-hmm.
only Apollo has in India, other than Tata.
Yes.
So they are very advanced. They have the latest. They have developed the CAR T cell therapy.
Yes.
So of course they do that. So there everything is covered. But if you go to maybe a medical college in a district,
Yes.
they may not have PET scan.
It's can, yeah. Mm-hmm.
They MRD definitely is not available in most of the hospitals, not because the hospital can't afford it or anything. It's because the number of children who need it are very few, and they don't want to invest in the machine. So there are outside labs who do that, even for private hospitals. But it is 10,000 rupees.
Yes. Yes.
So to give you an example, in Madurai Medical College, we started MRD because we said every child you will do MRD. We
Mm-hmm.
will give you the money. Before that, MRD was not tested, if you can believe it, Abhishek,
Wow. Yeah.
because parents couldn't afford it and parents didn't know where to give it
Yes.
because it's outside, right? And the hospital couldn't be bothered to do all these things. But
Yeah.
ever since we started working there, our social workers started working there, we have streamlined it.
Streamlined.
So let us say one thing very clear: there is no lack of expertise in India.
Okay, very good.
we have we have some of the best doctors in the world here. There is no lack, but there are logistical problems.
Right.
Suppose you take Tata Hospital.
Right.
Again, there'll be a minimum 50 to 60 children getting chemo a single day inpatient.
Yes.
Outpatient, I don't even know. In a day chemo ward, I don't know how many children will be getting chemo a day.
Yes.
So if every one of them, say below 10 years old,
Yes.
if the hospital needs to give chemo pot, it's a surgery.
Yes.
You need to have a theater. You need to have an anesthesiologist. You
Yes.
need to have nursing staff,
Yes.
which means their theater will be constantly occupied, right?
Correct.
Even if they have three, four theaters.
Yeah, I mean that's interesting point. I think now I
Yeah.
understand because when I was speaking with the TMH team and we were talking about the challenges there, and they were saying, hey, we could use the system that we have also to help them plan their own logistics internally
Yeah. Yeah.
because the
Yeah.
current systems are not designed to the level of detail that is required essentially, as you
Yes.
said, by
Yes.
the clinical social worker, but also by doctors, right? Also by
Yes.
the
Yes.
administration
Yes.
to
Yeah.
plan their capacity accordingly. Yeah.
Yes, thank you, Abhishek. And I would like to reiterate it once again to all the people who are listening to this, that everything that I said at the end of the day is data.
Yes.
So we need to have this data some way so that we can access it and utilize it in the best way possible. And that's what the app does actually,
Yes.
streamlining everything and making it kind of eternal so that it is there
Yes.
for future use for the children. So, so all the very best to you again, and I am really wishing you all the very best success for this event.